that we can apply in our businesses that can help us get open. So, today's a brief webinar. I'm going to give a quick 5-minute introduction and perspective of kind of what this pandemic has shown me personally over the last few months. And then I'm going to hand it over to the professionals. I'll let Dr. Charles Thompson, who's our Chief Medical Officer, talk about COVID safe business standards, as well as Amanda McCarty, who's our Director over our Employee Health Program. So we'll get right into it.
Jeff, you're muted. There you go.
Am I on now?
You're good now.
One of the things that I want to challenge everybody to do is really just look at your perspectives. I think this is one of the things that is changing so very rapidly on a week-by-week basis. This is an unprecedented thing, this pandemic of coronavirus. We had the first case, at the first of the year. Next thing you know, we're having a travel ban in March. Then we're on lockdown and shelter, something none of us have had in any generations. And so this has dealt and pushed us into stock market volatility. As of last week, I believe there was over 38 million unemployment claims nationally just since mid-March. The deaths have exceeded 100,000, even though they are far below what a lot of epidemiologists believe would be projected. And we're also figuring out, okay, is this decline in hospitalizations and deaths, is this a flattening of the curve, or do we need to be worried about a second wave? And I would tell you that those are all really good questions, and they're things that I'm asking myself and my team's asking each other on a daily and weekly basis. But to give you an idea of how those perspectives change so rapidly locally, first week in March, we had a physician who came back from Japan. And we, per CDC standards, asked that physician to quarantine for 2 weeks. And there was a lot of people who thought that that was a really aggressive move when it came to how we would approach keeping our community and keeping our staff safe. 2 weeks later, everybody was asking, well, why did you quarantine people who are going to Houston or Shreveport? And that was just how quickly, within 2 weeks, the perspective about travel had changed. Look at visitation policies. One of the things that we are very aware of is having family members at the bedside. It's a very important part of the healing process. When we first started screening, we were looking at, did you travel to Wuhan, China? Did you travel to Iran or Italy? Did you have respiratory as well as fever? We've gotten to a point now with no visitors whatsoever, and also being able to, screen not only for those particular respiratory and temperature things, but also to look at people who have been exposed to others with COVID. So this is all changing so quickly, and it's causing us, not only in the healthcare industry, but also within, whether you're a restaurateur, a bank, or any local business, you're having to re-engineer your operations and look at how you do things differently. So that's what Dr. Thompson is going to talk about today. As far as moving forward, this is just really an opportunity for us to give some of the lessons learned we've had over the last few months and give you guys some best practices, as well as be able to answer any relevant questions at the end. But I really wanted to leave you with 3 main points. And they're high level, but I think that they're good to follow. 1, be flexible. I will tell you that we have grown in our sophistication on a week-by-week basis, not just in the screenings and in the visitation, things of that nature. The way that we've been able to have an ability to keep our staff safe by creating hot, warm, cool zones for different areas where we're taking care of COVID patients has been tremendous. We've been able to put separate tracks for patients altogether for an emergency department versus ones that have COVID. We've been able to put separate tracks in place for people who are having an elective surgery versus a patient who's admitted for COVID. So be flexible, work within your operations to provide the best care for both your staff as well as the community. 2, be vigilant. It's not going to be perfect. You may have a restaurant and you're putting people 6 feet apart and you're only opening at 25 to 50% of your capacity. There's going to be people that come in and they don't follow safe standards, or people that are trying to, maybe not follow the kind of guidelines you're put forth. So be vigilant in helping make sure that those standards are enacted. And then lastly, be forgiving. I will tell you that we, as you guys know, opened up our visitation policy last week. We had such a tremendous level of support by people who were wanting to come back in for, say, x-rays. Well, we realized very quickly as we were watching our waiting rooms that we needed to expand your capabilities. And that was something that we needed folks to be forgiving about, because we knew that our demand for the services that we were providing were in exceed of what our waiting space was when we were social distancing. So we made those changes, and we were able to do that day one. So be forgiving within your own business as well as the businesses you patronize. So for that, I'm going to hand it over to Dr. Thompson. He's going to talk about some COVID-safe business standards.
Hello. So what I'm going to talk to you today about is how do you safely open your business, how do you protect your customers, and how do you protect your employees? And there is a role model for businesses in the country, and that role model is healthcare. It's our hospital. We had to learn how to do it. Over the last 2 months, we've gone from a full-service hospital to a COVID hospital, and now we've come full circle. We're back again, a full-service hospital and a COVID hospital. We had to make sure that we were safe, and we had to make sure that all our patients are safe. Our main concern, I know everyone's tired of hearing this, but we were trying to flatten the curve. We were trying to keep from being overwhelmed. And there were some days back in April, that we were worried that we might be overwhelmed, that we might be overwhelmed in our ICU or in our medical beds or our ventilators. Fortunately, we were not. We did flatten the curve, and we weren't trying to prevent the spread of the disease. We were trying to limit it so that we could. Jeff's helping me out here. Okay. Go down one. You good? So this is our curve using current data from Nacogdoches County, and you can see this nice flat curve. There are 5 things that you need to do to keep yourself safe, your employees and your customers. And this is from an article recently published by Dr. Atul Gawande, who is a surgeon in Boston, who's a author, and he writes about safety and quality in medicine. He's one of my favorite authors, and there's 5 things that you need to do, and they're pretty simple. They're not things you need to do, that you've heard of before. These are not going to be novel ideas, but you need to do all 5. The virus, each one of these by itself is not enough, but all 5 of these things we can beat the COVID virus. The first is to wash your hands. We wash our hands now more than we ever have. I wash my hands 30 times a day. My hands are irritated, but it's what we have to do. In the military, they did a study where they took recruits, and it's a large number of recruits. Half of the recruits, they had the recruits wash their hands 5 times a day, and the other half, they told them to go about your business. At the end of boot camp, the recruits that washed their hands 5 times a day had 45% less respiratory tract infections than the other group. So it is important to wash your hands, and that's the first of the 5 things that you need to do. Second is social distancing. You need to keep 6 feet apart. Your employees need to screen themselves. And what I mean by this is they need to know what the symptoms of COVID are: fever, cough, shortness of breath, and loss of taste or smell. If they have any of those, they need to report that to you before they come to work, and they need to be tested. And they can call our number. I'll give the number again at the end of my talk, the number you call to get your employee or customer tested. The next thing is that you should do is a mask, and it doesn't really matter if you wear a mask, a cloth mask, a homemade mask, or an N95. If you wear a cloth or surgical mask like this, it will prevent you from giving the virus to someone else. If you wear, and it's the same with a t-shirt mask or a homemade mask, but if you wear an N95, then that prevents transmission both ways. It prevents me from giving it to you and you giving it to me. And the last or 5th thing is what Dr. Gawande called culture. And that's the conflict between personal liberties and keeping yourself and other people safe. When we come to work at the hospital, we put our own civil liberties aside. To us, it's all about patient safety and safety, having a safe work environment. So we put our civil liberties aside and we put the mask on. And I would encourage you to do the same thing at your business. You want to be able to protect yourself, your customers, and your employees. It is important that you do social distancing, you do hand hygiene, and that you wear a mask. So, any questions?
We haven't had any questions come yet. Thank you, Dr. Thompson.
Great.
Thank you.
Well, thank you, Dr. Thompson. Appreciate that very much.
Oh, we can send the slide deck if somebody wants to see the.
Oh, yeah, we can send that out too. I mean, to Dr. Thompson's points, I mean, none of these things are things you haven't heard if you've watched any of the news channels for the last few months. I think really it comes down to finding the very specific way within your business to not only breed confidence amongst your staff, but also amongst your customers. I know for many of you, like me, you've been out and about and you've gone into different stores, whether they're restaurants, grocery, businesses, you name it. And I'd be lying to say I didn't feel more comfortable for places that had significant more presence for environmental service workers. I would be lying to say it didn't make me feel better when I walked into any store and there was a significant amount of hand hygiene accessible to me. Just if I wanted to go and get my hands clean after walking into a place of business after touching the door handle. I mean, these are just different things you can do that are basic. That can help you and your customers feel more safe.
I need to show them what we did in the hospital.
Dr. Thompson's going to show you a couple of quick slides here that have to do with how we started COVID safe care practices at Natchitoches Medical Center.
So we took the areas of patient that we're going to have any COVID-19 patient, and we've made a safe zone. We call it a cold zone and a hot zone. This is a slide showing our two separate ambulances. We have a respiratory we have a respiratory ER and a non-respiratory ER, so that we can keep these people over the last 2 months have been afraid to come to the hospital. And we've gone to great efforts to make sure that we can keep people safe and then we can keep our employees safe. We've had very few healthcare infections in our hospital, and Amanda tells me it's less than 1% of our doctors, nurses, and respiratory therapists have been infected with the COVID-19 virus. We have made safe zones in our ER and our nursing units where COVID patients are taken care of. We want to be able to have hot zones and cold zones so we can keep them safe at all times. This is a picture of our second floor, our medical floor, where we have a nursing station that's completely safe. It's cold, so you can walk in there and feel safe, feel sure that you're not going to get the virus by touching anything in that safe zone. Okay. Now I'll turn it over to Amanda.
Thank you, Dr. Thompson.
Hi, everyone. I'm Amanda McCarty. I am a physician assistant, and I'm the Employee Health Director and Therapy Services Director. And I've been with Natchitoches Medical Center for over 20 years now. I'm one of the old timers, you could say. So keeping our employees safe and in turn making a safe environment for our patients is extremely important to me. And as you can imagine, we've had to significantly increase the monitoring of our employees. And so one of the main things that we have done is we've set up daily health checks for our employees. We have limited the entrances as they come in, and so we are monitoring their temperatures. We're asking them questions. Have they been tested for COVID-19? Have they been around anyone outside of the hospital that's tested positive for COVID? And we ask them about their symptoms. You can see that there are a multitude of symptoms for COVID-19. This is from the CDC, and they do update it very regularly. Actually, since this slide, they have added runny nose, congestion, nausea, and vomiting to the symptoms. So it does get kind of confusing and a little difficult to decipher what symptoms are really COVID-related and what are not. So making sure that you set up a station where you are either checking your employees or they're virtually letting you know what their symptoms are. Those are a couple of options for you. We are, like I said, are using someone at a door so that they're checking temperatures and checking symptoms. Actively encourage your staff not to come to work sick. This is an example of a sign that CDC has. We have a similar one at our employee entrance, but really communicating with your staff and making sure that they understand that you don't want them there if they are feeling ill, and you want them to let you know what's going on with them. I'd like to go through a few scenarios. If you do have an employee that comes in, they try to come to work and they have symptoms. They have a headache, they have fever, they checked it's 100 degrees, they have a sore throat. You need to explain to them that they're going to be excluded from work. Those are symptoms of COVID-19. You need to ask them to contact their healthcare provider. So then the question is, when can they return to work after this? And so you have two different strategies for returning an employee back to work once they have symptoms or once they've been confirmed positive. The symptom-based strategy is your first strategy, and that would be that they meet 3 criteria. So they have no fever for at least 72 hours without the use of fever-reducing medications. Their other symptoms that have improved, such as their cough is getting better, or their sore throat's better, or their shortness of breath is better, and at least 10 days have passed since the first symptoms appeared. So they have to meet all 3 of those criteria for them to be able to return back to work. If you use the test-based strategy, there are also 3 criteria: no fever, not using any fever-reducing medicines like Tylenol or ibuprofen, the other symptoms have improved, and then 2 negative tests at least 24 hours apart. This might not be ideal for all situations because some of the tests take at least 72 hours to get back. So by the time you get 2 back, you may be at the 10 days anyway. So initially, we as a hospital have used the symptom-based strategy. We're looking at other measures to see if we can use the test-based strategy. Your next scenario would be if your employee tested positive for COVID, but they had no symptoms. So that would be 2 different strategies also. Symptom-based strategy would be that at least 10 days have passed since the date of the test, and that they've remained symptom-free. The test-based strategy would be that they had 2 negative tests at least 24 hours apart. Of course, that would mean they would have to have 3 tests, so they might not be inclined to want to do that. They're not extremely pleasant. The third scenario would be if you had an employee who had close contact with a person confirmed positive for COVID-19. And that doesn't mean that they were in a room, 15 feet apart from somebody and were there for 5 minutes. It means that they were living with someone, they've had at least 15 minutes of prolonged contact with that particular individual that's positive. And if that's the case, then a quarantine is recommended for that individual, 14 days since the last exposure date. And if no symptoms develop, they can return after 14 days. In both of these last 2 scenarios, if any symptoms are developed, then you would, of course, revert back to your the original discussion about symptoms, suspected COVID and COVID-19 positive. If you will look at the Texas Department of State Health Services website, you will see that there are quite a few different checklists for employers. This is an example of one for all employers, but they do have multiple checklists that are very good and are specific to certain types of businesses. Also, I would recommend that you visit the CDC website regularly. If you go on the main page and you go down to communication resources, and you check what's new, then it'll give you all the updates from the CDC, which are quite often, and it will tell you what date that they were updated. We've just recently had some new updates here that have affected us, and so we do have to stay on top of things, and I certainly recommend that you do the same thing. So that's all I have for you today.
Thank you, Amanda. All right, Larissa, I think we've timed this out pretty good. We've got some time for questions, and whether they're, related to the presentations today or other things, I would be happy to field them here with Dr. Thompson, myself, and with Amanda.
That sounds great. Thank you, guys. I do not see any questions rolling in yet, but feel free to ask those questions. Feel free to unmute yourselves or type in a question. Just some general notes from me. You know, we've now that we've flattened the curve and we're kind of skating on towards hopefully this ending sometime in the future. I think it's important to continue this discussion about workplace health. I was just talking to the fire chief this morning, and we were talking about flu season and how at one point in the last couple of years, when you look at that flu hotspot map that we see from time to time, Nacogdoches, Texas was the hottest place in the state, maybe the country, for flu on this given day. Not today, on a given day a long time ago. And so that just goes to show that all of the things that we're putting into place in our workplaces don't just apply to COVID. They could apply to flu season that starts, in September? So these hand washing stations, reminding people that they have sick leave to use, maybe taking people's temperatures, things like that. Those are all things that we can apply in the future, and maybe save ourselves some heartache in a future flu season. Or you hear about outbreaks in other communities of those traditional childhood diseases that we all thought that we had gotten past. Some of those are popping up, measles and things like that. So I think that's an important way for us to step to the future to keep all these things in place. Also, just a quick commercial about our local numbers, a message from the City and County Emergency Task Force. There has been a huge increase in the number of tests given over the last week. You've probably heard about that Pilgrim's Pride was being tested. Nearly all the employees there were being tested. So just kind of as a community PSA, we may see case numbers increase drastically, but that does not mean that we have had a huge spike in cases. It means that we've identified more cases. A large portion of those people are probably going to be asymptomatic. Doesn't mean that we should change our behavior. It means that we should be doing what we've been doing all along, which is wash your hands, don't touch your face, all of those things. But I'm just urging everyone to not panic when they see those numbers, because they could increase significantly. And with that,
you know, one of the things that was interesting for me is as we watched this grow in number of positive case results as well as hospitalizations, you know, we thought we were not going to peak until sometime in early May or mid-May. And when we looked back at our numbers, we prepared for a peak in early or mid-May, but we actually peaked from a hospitalization standpoint on the 17th of April. So we've only seen a steady decline in hospitalizations for over a month now. And, you know, those are things that we haven't stood down any of our operations, or we haven't stood down anything with respect to the availability for readiness of a second wave should that happen. But, you know, these very basic principles that we discussed today, Dr. Thompson discussed that you can employ within your particular business, or, you know, the checklist of items that Amanda mentioned that can be helpful for you making sure that you have a safe workplace. You know, these are all things that are going to be applicable to all businesses, and I think they're going to help us carry through, whether this does have a second spike or whether it just becomes endemic like the common cold. You know, we just have to be very thoughtful in how we're doing our hygiene.
Absolutely. Absolutely. Well, I appreciate you guys at the hospital putting the time and effort that you put into this. We did record this session, and we'll load it to the NEDCO webpage so that others can access it in the future. And like I said earlier, we'd like to continue this series. So if anyone has any thoughts or ideas about future workplace wellness or community wellness they want to hear about, let me know, and I'll tap Jeff at Medical Center and Gary at Memorial and see if we can't get some medical officials on board. So thank you guys. I appreciate you.
Thank you. Take care.
Signing off. Bye.